Imagine this. A child is critically ill, maybe injured. Chaos erupts. It's overwhelming, right? But what if there was a system, a clear roadmap to cut right through that chaos and focus on what matters? Well, there is. Today we're diving into the ABCDE approach, a powerful, structured system that medical professionals use to save young lives when everything is on the line.
So let me ask you this. In that situation, what's the very first priority? It's a tough one, isn't it? When alarms are blaring and everything is happening at once, how do you even know where to start? That is the exact problem the ABCDE approach was built to solve.
So here's our game plan. First, we're going to set the scene to understand why this kind of system is so crucial. Then, we'll walk through each and every letter, A, B, C, D, and E. We'll even see how it can adapt on the fly. And finally, we'll zoom out to see how it fits into the grand scheme of emergency care.
All right, let's get into it. And really, to appreciate the system, you first have to understand the high-pressure world it was designed for.
Think about it. A child's condition can change in a heartbeat. Fear is through the roof. Confusion is everywhere. And here's the thing. Kids aren't just tiny adults. Their bodies react differently, and they can't always tell you what's wrong. In that kind of chaos, having a structured approach isn't just a nice-to-have, it's absolutely essential. It's what turns chaos into control and makes sure you find and fix the deadliest problems first.
Okay, so that's the problem. How do medical teams cut through that chaos? They rely on a system that's been tested and refined in emergency rooms all over the world.
And that system is the ABCDE approach. At its heart, it's a priority-based method. It's designed to do one thing, and do it really, really well. Find and manage the conditions that are the most immediate threat to life, in the right order. It takes this huge, overwhelming crisis and breaks it down into manageable steps.
And these are the steps: airway, breathing, circulation, disability, and exposure. The real magic here is the sequence. You don't skip ahead. You make sure the airway is secure before you even think about breathing. You fix a breathing problem before you move on to circulation. It forces a methodical, deliberate primary survey.
All right, let's dig into the details. Section 3 is all about the first two, and you could argue the most critical steps, airway and breathing. First up, A is for airway. The big question is simple. Is it open and clear? Medical teams will use the look, listen, and feel method. They're looking for the chest to rise and fall, listening for breath sounds, and feeling for air movement. Any weird sounds like snoring or a high-pitched noise called stridor are big red flags for a blockage. And here's a really important point. If a conscious child is sitting up to make it easier to breathe, you let them. Forcing them to lie down could make things a whole lot worse.
Now this is a crucial complication. If a child has been injured, you can't just think about the airway in isolation. You have to assume there could be a neck injury. That means securing the airway and protecting the neck, or the cervical spine, have to happen at the exact same time. They are completely linked.
So, once the airway is clear, we move on to B for breathing. Is the child actually breathing effectively? You look at two things, the work of breathing and the effectiveness of it. For work, you're asking, are they working too hard? Breathing too fast, using extra muscles, grunting. For effectiveness, you're asking, is it actually working? Is their chest moving well? Is their skin color okay? Or is it turning a bit blue, a sign called cyanosis? The whole point is to fix these breathing problems before they lead to something worse, like a cardiac arrest.
Now for Section 4. We've got air going in and out, which is great. The next priority is making sure the body's delivery system is actually working. That brings us to circulation and disability.
C is for circulation. The question here, is blood getting where it needs to go? The absolute #1 priority is to stop any major external bleeding right away. After that, you're looking for signs of shock, which is just a state of inadequate blood flow. You check things like heart rate, how warm their skin is. This is also when you'd get IV access and hook the child up to a heart monitor.
And this is where the system shows you just how flexible it is, which is fascinating. In a really bad trauma situation with massive uncontrolled bleeding, the protocol actually flips. It becomes CABC. That first big C stands for catastrophic hemorrhage, because in that extreme case, stopping that bleed is the #1 priority, even before the airway. It makes sense, right? A person can bleed to death in just a few minutes.
Next up is D for disability. Now, this is really just a rapid neurological check. The team needs to know, how is the child's brain functioning right now? They use a simple scale called AVPU. Is the child alert, responding to voice,
responding only to pain, or are they completely unresponsive? They'll also check their pupils. And critically, they'll check the blood sugar because a dangerously low glucose level is a common and thankfully reversible cause for a decreased level of consciousness.
So for our fifth section, we'll hit the final letter, E for exposure, which is all about getting the full picture. And we'll also see how this entire system is not some rigid checklist, but a constantly evolving piece of medical science.
E stands for exposure. And to do a proper full assessment, well, you have to be able to see everything. This means carefully removing the child's clothes to look for any hidden injuries, rashes, or sometimes even signs of abuse. But this step comes with a really critical balance. You have to prevent hypothermia by keeping the child warm, and you must always maintain their dignity.
The ABCDE approach gives you the framework, but the specific actions inside it are always being updated. This table is a perfect example of how these guidelines evolve. For instance, the recommendation for infant CPR has shifted. Now, the 2 thumbs encircling technique is recommended for everyone. And why is that? Because study after study has shown it can generate better blood flow to the heart and brain. It shows this system is alive, constantly being refined by new evidence.
Okay, so that's the whole primary survey. But the crucial point is, how does this structured approach fit into the overall system of care? Let's zoom out.
And this is the perfect way to visualize it. The ABCDE assessment isn't just some isolated event. It's a key link in what's called the chain of survival. It connects the early recognition of a sick child with advanced life support and all the care that comes after. You can almost think of it as the engine that drives the entire resuscitation process. This quote from the European Resuscitation Council really gets to the heart of it. The whole purpose is to improve the quality of care by providing a clear, priority-based method to navigate the chaos. It's about acting decisively and correctly when every single second counts.
So the ABCD approach is an incredibly powerful tool for the professionals on scene. But it makes you think, doesn't it? From public awareness and CPR training to hospital systems to post-discharge support. What does it take to strengthen every single link in that chain? Because that's what truly saves lives.